From hot flashes to mood swings to hysteria, menopause is often misunderstood and gets a bad rap. It's a natural part of a woman's life and can be accompanied by a range of symptoms. But with the stigma attached to it, many women are in the dark when it comes to information, support, and medical care. We're bringing the menopause conversation out of the shadows. Tonight's live broadcast and live stream of insights on PBS Hawaiʻi start now.
Aloha and welcome to Insights on PBS Hawaiʻi. I'm Yanji Denise. The change, the pause, the big M, whatever nickname you may have for menopause, it's a natural cycle of life. Menopause occurs when a woman's menstrual period stops for good and she can no longer get pregnant. But menopause is more than just the end of menstruation. The hormonal changes can affect a woman's physical, emotional, and mental health. For decades, menopause has been shrouded in shame, despite the fact that nearly 2 million women in the U.S. will reach menopause each year. Tonight, we are tackling the issue of menopause, taking it from taboo to treatment. We look forward to your participation in tonight's show. You can email or call in your questions, and you'll find a live stream of this program at pbshawaiʻi.org and on the PBS Hawaiʻi YouTube page. Now to our guests. Dr. Melissa Lawrence is an obstetrics and gynecology physician. She's been at Kaiser Permanente for more than 2 decades after completing her education at the John A. Burns School of Medicine and her OBGYN residency at the University of Hawaii. Dr. Sarah Canyon is a primary care physician with board certifications in family medicine and lifestyle medicine. She's the founder, CEO, and medical director of both Canyon Primary Care and Olakino Center for Lifestyle Medicine in Kailua. Dr. Emily Goulet is a reproductive endocrinologist and infertility specialist who practices at the Fertility Institute of Hawaii. Her past research centered on how menopause affects hormones in the brain, with particular attention to sleep and circadian rhythms. And Dr. LeighAnn Frattarelli is a gynecologist who's been seeing menopausal and perimenopausal patients for more than 25 years. She believes better education for providers and patients is the most important step towards a healthy and happy menopausal transition. Thank you all for being here tonight, doctors. I'm so excited about this conversation. Dr. Frattarelli, I want to start with you. We briefly described what menopause is at the start of the program, but can you tell us a little bit more about what actually happens to a woman's body when she starts menopause?
Yeah, so starting menopause for most people, we actually mean entering the perimenopausal phase. So that is when the ovaries start to become older, less frequently, the eggs don't come out as regularly, and the hormone levels can vary widely. And that happens anywhere between about 2 and 10 years before the final menstrual period. So when people say menopause, they often are meaning the time, that whole period of time. But we have the perimenopause, and then we have menopause, which is exactly 12 months after the final menstrual period. And then after that, we have what oftentimes is called postmenopause. And so the ovaries are no longer working, and we're no longer getting the estrogen that we had in our younger years, reproductive years.
2 to 10 years for perimenopause. Yeah. That's an awfully long time.
It's an awfully long time.
And I know we're going to get into some of the symptoms of what that's like. But Dr. Lawrence, can you tell us what age does this start to happen in women, and what do you see in your patients when they start to enter first the perimenopause and then the menopause cycle that the doctor just told us about?
Yes, thanks. So the average age for menopause in our country is 50, 51. And so for a few years prior to that, the first thing you'll probably notice is some changes in your menstrual cycle regularity. And oftentimes that'll be associated with other symptoms like hot flashes and night sweats and mood changes, things like that. And then your menstrual cycles will space out and eventually stop. And if you get, like LeighAnn mentioned, if you go a whole year with no menstrual bleeding, then you're in menopause.
Okay. And Dr. Goulet, can you tell us a little bit about that perimenopausal cycle? In your patients, what do you see as sort of the initial symptoms that people start to report, and how do you differentiate between just being a hardworking woman, maybe a mother who's very busy and tired from raising children, and actually being in perimenopause?
The textbook definition would be cycle irregularities, But in that transition, because of the hormone fluctuations, we often get other symptoms, including those vasomotor symptoms, hot flashes, night sweats, including the mood changes, which could mean depression, anxiety, especially if you've had a history of that before. We see an increase in memory problems, in sleep disturbances. The transition of menopause is often associated with a lot of changes in both the physical body as well as the mental brain.
And how can we distinguish what's actually happening to us? You know, I mean, I'm 46, I have 2 kids, I know that I'm very busy. How do I know that, oh, this is perimenopause and this is just being a tired mom?
I think that it's a Venn diagram, that there is a lot of overlap with those things. And certainly looking at our lifestyle and optimizing the things that we know how to and we can optimize is one way to improve things. I think that hormones and hormone therapy is often mislabeled as sort of the fountain of youth or a cure-all, but I'm not going to be able to reverse aging. That's not something that we have the ability to do yet.
Dr. Canyon, let's talk about what we can do if we are experiencing these types of symptoms. What are some of the treatments that are out there?
Oh, there's a whole variety. There's no one size fits all, I think. I think that's a very important take-home message because, as you've already heard, the range of symptoms that a woman may experience that could be attributable to perimenopause or lifestyle or pressures in their life is quite wide. And so when it comes to this stage of life, I think the important thing is to find out what is most important to the person before you and work from there. So if at the time that they see you, they're reporting what we call vasomotor symptoms or hot flashes, and that's disturbing their sleep, and that's causing them to not be able to perform to their optimum the next day, well then sure, hormone therapies might be the answer, and estrogen is typically what we associate or has the strongest evidence for addressing that. Alternatively, if you have a woman who's having symptoms that may be more, let's say, irritability, anxiety, mood swings, that sort of thing, while hormone therapy may be an appropriate treatment, there are other options for that too, for someone who doesn't want to go down the hormone pathway. So some of the medications that are known to be like antidepressants or anti-anxiety medications do actually have a place, a very good place in this time of life. So those are some of the prescribed medications, but what also comes to mind is there are natural therapies where we do have some limited evidence on that some women might want to try too. And then of course, as we were talking about earlier, there's lifestyle treatments too, which is my greatest passion. So
yeah, tell us about some of those. If you don't necessarily want to go down the prescriptive route, could it be diet, could it be sleep, could it be exercise? What would you suggest?
Absolutely, the cleanest diet that you can have is going to be beneficial for the symptoms that you may experience in perimenopause. So when I say that, what I mean is avoiding processed or ultra-processed food, which is very topical at the moment, for a good reason. We have very strong evidence that eating whole food, plant-based diet, and we're talking about foods that you can recognize as coming from the earth. So good old-fashioned fruits, vegetables, grains, nuts, legumes. There have been studies that have shown that eating in this manner may decrease your vasomotor symptoms, may improve sleep, as well as getting adequate exercise is there's actually some wonderful studies on how exercise impacts anxiety, for instance. And anxiety is something that we see a lot in the perimenopausal period, which is certainly related to hormone fluctuations, but these are things that you can do without having to take a medication, you know, so adequate exercise, sleep, challenging for all of us. We live in a dark, deprived society. We have lots of lights around us in the evening. And then stress management is something that I think we can all learn to do better. These are, what I'm saying here is really, I'm saying the pillars of lifestyle medicine, which are nutrition, physical activity, stress management, sleep, and social connections, which is a very important thing that I think what happens in the perimenopause, menopause period is women because we haven't been talking about it, because we haven't been very forthright in explaining about what we're going to, we're maybe not reaching out to our peers, you know, about that. So women become isolated at this time. I see a lot of women in my primary care practice who even feel shame that they've put on weight, because weight changes when we start to lose our hormones. Belly fat develops. How the distribution of weight in our body changes. And so women become isolated and they feel ashamed of these changes in their body. And it's really sad.
Yeah, you've laid out a lot there. Dr. Frattarelli, you've been helping patients with this for some time. How do you think the conversation around menopause has changed, and what are some of the misconceptions that we still have about this?
Yes. Well, you know, many, like early on, hormones were kind of promoted as something that were good for everyone, and that would make women more, you know, sexy, and you know, and then they started kind of trying to use it for prevention of heart disease, and we thought that it was better for the brain and better for the heart. And then the largest study ever done, the WHI study, came out. It was a randomized controlled study. Great plan, not the right population, not looking at the right things, but when the study results came out in the early 90s, it did show that there was, in this one study, an increased risk of breast cancer and an increased risk of heart disease for women taking hormones. And then the conversation stopped. Overnight, people just went off their hormones and pretty much just stopped talking about it. And finally, we're realizing that even that big, wonderful study that was done, you know, we kind of re-looked at it and looked at the appropriate age group. The women who were having symptoms, we kind of looked at it and realized that we're using some different formulations, and there were some really some big champions for not saying no to hormones and talking about the menopausal transition. And now this pendulum is swinging the other way, and people are just, you know, coming in, asking. There's a lot of things on social media, TikTok videos from people who really know what they're talking about. Some doctors like Heather Hirsch, she's a big social media person. Mary Clyde Claiborne, Haber, thank you. You know, it's been doing a lot of that, and so it's being talked about a lot more. And these people on social media are telling patients to come to your doctor, take this information, come armed with knowledge, and ask them for what you need, and ask them to, you know, individualized therapy for you, but that you want to do everything you can. And so that's what we're seeing now. We're seeing women coming and advocating for themselves.
And we've got a lot of you writing in with your questions tonight. Thank you for so many of you already writing in and calling in. So let's get to some of these. Dr. Goulet, I'd love for you to take this one. Does birth control affect menopause? You mentioned irregularities before menopause hits. What happens if you're on birth control?
You know, birth control, we don't really think affects the timing of menopause. It can certainly help mask the onset of some of the symptoms, because birth control are synthetic hormones. They're not bioidentical to what your body would normally make, but they do the job of fulfilling the hormone receptors so that your brain is not sensing the deprivation or the lack of those hormones. So oftentimes women who are on contraception through their perimenopausal transition in their 40s, it's rare to get pregnant in your 40s, but it absolutely can happen. So if you need contraception, by all means, you should be on contraception. And if birth control is safe for you, if oral contraceptive pills is safe for you, it's a great option. And it does a great job too of holding off a lot of those perimenopausal symptoms, such as the hot flashes.
Interesting. Dr. Lawrence, can you take this one? This is from Kealoha in Honolulu, and thank you, Kealoha, for writing in. Is there a connection between menopause and ADHD in older women? We hear a lot about ADHD these days. Is there any kind of a connection there?
Oh, you've done a lot of research on that.
Well, Dr. Goulet, we can toss it over to you.
Well, you know,
know, it's the brain, the architecture of the cells as we age. It's not like it was when we were in our 30s or in our 20s or in our younger years. And so we should expect that it's going to function differently than it did when we were younger. And with that different architecture, with the remodeling of the neurons and the synapses and the connections that we have, ADD, ADHD symptoms is absolutely something that we can see as sort of the onset of how our brain is going to function a little bit differently as we age, and that's normal physiology.
Dr. Kenyon, this one says, you mentioned lifestyle. Do certain foods or drinks help with menopause symptoms? What about supplements? We talked a lot about, just whole foods, eating a, perhaps a more plant-based diet, staying away from the processed stuff. We know these are all good for things for us, whether you're male, female, menopause or not. But are there specific foods or drinks that help with menopause? And what about supplements? Because if you hop on Instagram and, you're over a certain age, you get a lot of targeted ads.
Yeah, I think one, you're talking to somebody who really does wholeheartely believe that food is medicine. But do I believe that there's a place for supplements? In fact, there is a place when, we rely on the supplement industry, for instance, when we diagnose our patients with osteoporosis, which absolutely affects the menopausal woman, and hormone therapy prescribed at the right time can protect from that. But there's a lot of pitfalls with the supplement industry that I struggle with, and that one of that is that it's an unregulated industry. And I certainly in my own practice, for example, had a patient on vitamin D3 for her osteoporosis, same brand, many years. Time again, we're getting these very low values for the first time in her life. And the only conclusion we could make, they've changed their formulation of her vitamin D3. So now we're changing it. So I think there's a word of caution I'm trying to present here when you're dealing with supplements. In terms of managing menopausal type symptoms with supplements, there are some therapies, there's not a lot of strong evidence, but things like evening primrose oil is used quite frequently in Australia and England, hit or miss in my experience. Flaxseed oil daily, hit or miss in my experience. So, I'm saying there are hits. Some people aloe vera, but I think black cohosh is, of the herbal supplements that are out there, is the one for hot flashes that has the most evidence behind it, but not anything near what we can provide. I can see LeighAnn shaking her head. Like the data, it's just not, yeah. So I think it goes back to, there's no one food that you can take ever that will address anything that you're having. It's a whole picture, whole person scenario. And that's where the American College of Lifestyle Medicine has identified these pillars of lifestyle medicine. It's, you are a whole person with multiple aspects to your overall health. And I would be remiss of me to, reductionist of me, to just throw sweet potatoes at you. Pardon me on this.
Thank you for that. Dr. Lawrence, there's a question from Eric in Kailua. It's an interesting one, and thank you for a man writing in tonight. Are there any suggestions for people whose partners are experiencing menopause, like how to deal with mood changes without being mean or insensitive? How do you advise? Because this affects the whole family, or at least the partner, with not only the individual going through it, but also those supporting them.
Yeah, actually, that's why a lot of people will come in and they'll say that they're having relationship issues, and they're not themselves. They're irritable, they're angry, they're kind of having outbursts and things like that. So just I guess explore it in a supportive way, with their partner, and maybe encourage them to come in and talk about it to their gynecologist or their physician.
Thank you. Monica has this question, Dr. Frattarelli, and we're just blazing through here because we have so many, which we love to have this viewer engagement. So thank you for those of you who are calling and writing. Monica asks, is there any pattern to how long a woman has to deal with the changes brought on by menopause? That perimenopause window, 2 to 10 years is quite a long time. And does the severity of the symptoms, are they on like a straight line up, or does it vary?
That is kind of a little sad because there's actually studies that show that the women who have the severe symptoms, early onset, their symptoms tend to last the longest. So there is about a 25% percentage of the people who have symptoms that will have severe symptoms for that 10 years perimenopause, and it will continue on. And we see women who can never get off their hormone replacement therapy. Sometimes they try to go off, they start getting these horrible hot flashes, night sweats. Again, it just comes right back. So there's not a set pattern. There's that pattern, which is the unlucky ones, and then there's people who really don't get any symptoms until right around menopause. And then, there's people who kind of have just mild symptoms for, shorter period of time. So it could be any of those things. For the most part, if someone comes into me perimenopause, they often find that they are symptomatic and then it goes away, because that's what their estrogen levels are doing. So they feel horrible, they have hot flashes, night sweats, maybe heart palpitations, and then they get better for a few months, and they're like, oh, it went away, I'm done. I'm like, sorry. It's really not done unless you're completely menopausal. Like if you have symptoms perimenopausal, it's going to continue to come back at least until you're done with all of your periods in that year.
And the other side of that, once you are fully through menopause, is there then relief?
Not necessarily.
Wow.
For more than half, there are, but there's a lot of women that continue on with that.
So you're saying this is going to go on forever?
It really varies.
Varies a
Severity
lot.
of symptoms.
It's about 7 years. So not everybody has it lifelong, but many women can.
Yes, please.
The year before last, I was at the American College of Lifestyle Medicine conference. And when we go to these really big medical conferences, there's these keynote speakers, huge convention center, huge thing. Then there was a side talk on menopause. It should have been a keynote. There were doctors lining the walls. I was sitting on the floor, and it was a huge room already. And that just sort of said to me, wow, we are interested and we all want to do better by women. I almost kind of got chicken skin right now because I really think we do. I think a lot of people think they're not being heard by their doctor. I think your doctor does want to do their best for you. But what was super neat about that talk was the woman presenting it showed what we call quality of life scores. And it started with women in their 30s up until their 70s. And of course, when it got to the perimenopause or menopause period, there was this huge dip in quality of life scores. But then the graph started to go up and up and up, and the women were reporting a better quality of life into their 60s and 70s than they had in their 30s. So I feel like there's a silver lining, light at the end of the tunnel.
That is encouraging.
One of the big symptoms, the brain fog that women can get, that actually does tend to get better about a year after menopause. So that would be about 2 years after your final menstrual period. So that does get better.
That happened for me when I had my kids.
Yeah.
So that hasn't stopped.
Interesting that you mentioned that, because having a child, those hormones are very similar to the perimenopause. You have this huge plummet in your estrogen levels, in your progesterone levels, which is the same thing as what women who are going through their perimenopausal transition are experiencing. So the birth of a baby or breastfeeding even is a little bit of a taste of what's yet to come.
Wow. Beth from the Big Island, I'll stick with you, Dr. Goulet, says, so many of us miss the opportunity for bioidentical hormones. How old is too old to start? It's been proven that hormones help cholesterol, osteoporosis, heart disease, Alzheimer's. I feel like I missed the boat. What do you say to Beth?
There's two things I want to hit on here, the word bioidentical and the correct age range. The word bioidentical was this genius marketing event that happened through a book and through some celebrities that was really kind of misdirected on how hormones should be prescribed and treated. But I like to take back that word and define it as molecules, hormones, medications that are exactly identical to what your body is making. And so when we are prescribing bioidentical hormones, that's the exact same molecule your body is making. It has a much better beneficial profile for you than maybe some of the other types of hormone therapy that we can prescribe. As far as the appropriate age, the best time to be prescribed hormone therapy would be when you're in that transition, when you're starting to experience those hot flashes, or maybe in that year or within 5 years after your final menstrual period. We do have data that says, and this is that Women's Health Initiative, the big trial that the NIH funded so much money in. It was the largest study that our government ever, more than COVID, more than HIV, ever funded. It was a huge study, but unfortunately it looked at the wrong hormones and it looked at the wrong age range, as Dr. Frattarelli had brought up before. And what we learned is hormones are not safe when we start them far out from when you're going through that final menstrual period. And so I think that she has a valid concern, but everything is a risk-benefit ratio. So I would encourage individuals who want to get started on hormones because they're having severe symptoms to speak to their doctor, their lifestyle, their gynecologist, their primary care doctor, to talk about whether or not the risk or the benefits is something that could be appropriate for them.
Thank you for that. Dr. Lawrence, Shannon in Honolulu says, what about surgery-induced menopause? What types of surgeries might induce menopause, and how does it differ from naturally occurring menopause?
Well, primarily hysterectomy with oophorectomy, so removing the ovaries during surgery. That'll reduce your estrogen levels, and the symptoms are usually quite abrupt after surgery as opposed to a natural menopause where they can tend to be gradual and kind of fluctuating. You can also see it after certain medications, and like for instance chemotherapy, things could also induce menopausal symptoms.
And so that 2 to 10 year window that we were talking about is greatly reduced, and then you go through it much quicker? Okay, interesting.
I would like to add to that, though, if you are one of those younger women, younger than 50 or even 45, hormone replacement therapy at this age is very important because we're supposed to have those hormones until those early 50s. And so if you are having iatrogenic loss of those hormones, either your ovaries are being taken out or they're being damaged by chemotherapy medications, those individuals should talk to their doctors to see if hormone replacement therapy, a term we don't use very much anymore. We try to stick to the words hormone therapy, but those individuals truly need replacement of those hormones that are age appropriate.
Okay. Dr. Canyon, Lisa in Kaka'ako wants to know, should companies have policies or procedures in place to support employees going through menopause? I know that's more of a policy question, but for, when we think about how many women are in our community who are experiencing this perhaps without support, how much of this conversation should we be having with the wider community so that they understand that these are natural changes and in some cases unavoidable?
Wow, that's a really interesting question.
They do in Australia. My sister lives in Australia, and they get time off of work for going through the transition. It doesn't happen here though.
There's a lot going through my head because it's like I could see the controversy that would get raised if a company was going to do that. I mean, I think I don't mean to be a broken record here, but I think that workplaces could do a lot better in supporting people with lifestyle in general, and I think that would benefit your menopausal woman.
And we're kind of building on that. There's this question from Thelma, which perhaps can kind of fold into that, which is, we're told over and over again that family discussions are super important for so many things, including illness, even end of life, something we can all experience. Should menopause be included, and how do we get there? So how do we have these conversations, maybe it's not with your employer, but maybe it is with your spouse or your kids or people who are supporting you. How do you suggest broaching this topic? We'll start with you and then go to you.
Okay. Yeah. There's so many different things came up tonight, like the comment from Eric from Kailua. I've had patients come into the clinic with their partner because their partner wasn't understanding what they're going through, so that I could educate them about menopause. So I think one thing is, if you are symptomatic, you're talking to your partner. If you're getting a little bit of pushback, you can come see me, or come see your doctor. I'll help support you. But I think it's what we're doing right here, right now, is more exposure, more conversation. How do you start it? You just start it. I think why hold back? This is a natural part of life. This is 50% or more of the population is going through this. You know, this is not controversial. This is life. This is not a disease.
It's probably just awareness.
Just a couple of comments about the workplace, when we know that we lose a lot of productivity from women who are going through perimenopause and menopause. So the workplace has to be, they're going to get more from their workers who want to be productive if they're more understanding, and if they, have those programs in place where maybe they can pay for some of these menopausal consults, maybe like have no co-pays in menopausal replacement therapy, have some wellness programs. They're going to get more out from their perimenopausal and menopausal women work-wise if they do go to something like that. So maybe that's a starting place as to, encouraging the employees to put something in place. Family-wise, I'm kind of the thought that women should seek care for their whole family. And then they can, and discuss it with their family that this is what I'm doing. Maybe I need some more time in my life to be able to do these lifestyle. Because a healthy diet and exercise, it's very difficult if you're working 80-hour work weeks, right? So they need to let their family know what they need, and families have to be able to value that. But they also need to seek care for their entire family, because if you're not feeling good, it's not just you that suffer. Your whole family suffers. Your children suffer.
Yeah, to LeighAnn's point, something that occurred to me earlier to say was that perimenopause often coincides at a time in life when women are starting to find themselves and thrive in their workplace, and then boom, this happens. And I think exactly what LeighAnn said was what was running through my head, was that you have to communicate your needs and start to take the time for self-care and say, I need to do this to continue that thriving. I don't think that this needs to be a crutch that you or cross to bear. You just need time and space for the self-care, and you need good information on how to address it.
Yeah, and we have another workplace question here, Dr. Lawrence. Whether it's severe period cramps or menopause symptoms, sometimes it's difficult to go into work, but it needs to be done. What are some tips or advice when it comes to dealing with symptoms in the workplace? A lot of this is difficult because you don't, I don't know. Maybe I grew up in a different time, but I remember, hiding tampons, not wanting anyone to know that you're actually having your period. And so then to go to your employer and say, I don't feel well because I think I am in perimenopause, seems like a pretty tough conversation. So for this caller, what would you say some advice on dealing with the symptoms themselves when you have to be in a professional setting?
Well, that's a tough question. I think, you'd probably want to come in and seek care. I think most people do it that way. Most people will come in and seek care and try to find out what's going on, and then gain support from their employer after that. I guess I'm not sure I'm understanding what the question is.
Yeah.
Like how to deal with this. Yeah, if you're having symptoms, then probably should come in and get care.
Yeah. And Dr. Goulet, do you want to add to that?
Well, I think there's some easy things you can do for comfort, right? You can bring extra layers for if you're having chills, or you can bring a fan to keep at your desk. These aren't cure-alls by any means, but it's certainly not going to start a workplace war with the thermostat, right? And having an ice cold, cup of water with you, or your hot cup of tea. These are some simple things that may provide temporary alleviation of symptoms. I like those minty oils.
Essential oils.
Yeah, essential oils. Thank you very much. So those are some easy things that you can do. They're not going to be the end-all, be-all. They're not going to provide as much relief as I think the prescribed medications that we have in our toolbox.
Let me stick with you. This is Wallen from Palolo. Do men have a similar type of experience as menopause? Is there such a thing as male menopause?
Absolutely. Well, aside from the low T clinics and the testosterone, there is a significant population of gentlemen who are battling prostate cancer and who are on anti-androgens in order to to treat their cancers, and those men as well will experience very similar symptoms. They will have hot flashes, they'll have cold sweats, they'll have a decrease in their well-being, they report. So in general, as well as the low testosterone and that whole boom that we are seeing in medicine, there's absolutely a medical indication where we see men going through a deprivation of hormones as well and having symptoms.
Yeah, Dr. Kenyon, I see you nodding over there. What kind of similar symptoms do you see in your male patients?
I have had patients who have had the very treatments that you're talking about, and actually the hot flashes are so severe. And
in men?
This is when we give treatments to oppose testosterone so that the prostate cancer doesn't continue to proliferate or grow. And yeah, it is really, it kind of, it shows what women have to go through as a natural process. Right. Yeah, I've seen it really happen. But also I'm thinking about the low testosterone. Do they call it androgen pause? Andropause.
Yeah, or
menopause.
Yeah, but not to the same scale and severity. Correct. It sounds like.
Correct. Unless you're on these medications to block the.
Right.
Yeah.
Dr. Frattarelli, Billy asks, how big a role does external factors play in menopause, especially stress? How big a role do external factors play in menopause, especially stress? So how much of it is coming from inside and how much of it is the environment around us? We just went through COVID. We have a pretty fraught, political, a lot of news coming out of Washington day in and day out. And just, Hawaii is a very expensive place to live. We have all these factors that stress us out. And how much does that exacerbate menopause or the symptoms?
My opinion is that stress exacerbates almost every medical condition, and this one's no different. But it's not like stress is what is causing the symptoms. It's not why you get heart palpitations around menopause. It's not just, it's the stress. It's menopausal symptoms. It's not just the stress. So you can decrease stress and maybe improve your sleep, which might make you feel better, but it's not going to take care of everything by becoming stress-free, which we wish we could do.
If only. I'm interested, Dr. Lawrence, can you take this one? Are there things that women shouldn't do when we're going through menopause? Any triggers for hot flashes or lifestyle activities? This is sort of similar to the stress question, but are there things that we should avoid that exacerbate these symptoms?
I mean, you can't avoid going through menopause. You're going to go through the transition. You really are. And so, although some people will have severe symptoms and some people will have, milder symptoms.
And I wonder if some of that, because as we're talking, what occurs to me is that a lot of this is blamed on other factors. And so traditionally, because a lot of this is unknown, I think sort of anecdotally, we know hot flashes are associated with menopause, but a lot of the other symptoms that you guys are talking about, people might not necessarily connect that dot, right? So that we think that it's one thing, but it actually is perimenopause. Are there tests that we can do so that we can see, oh, this is actually, that you can create a straight line between what's happening to you hormonally? Are there, levels that can be checked and then they can say, yes, you are in perimenopause? Or I know we have the endocrinologist.
Yes, there are. In the perimenopausal period, feel free to jump in here. In the perimenopausal period, the hormone levels that you could measure are fluctuating a lot, and so they're not very helpful. And usually we'll just base things clinically, like how someone is feeling, and based on their menstrual irregularities, you can pretty much tell what's happening without blood tests, although there are tests that you can do. And I think as you go through the menopause transition, like with the stress question, I think it lowers your threshold to be able to manage other things. And the symptoms can be wide range. I mean, a lot of different symptoms, and so you don't really know what's going on. Most people will come in just feeling like they're not themselves. That's usually what they'll say. I just don't feel like myself anymore, and I can't get a handle on my weight and my relationships and my sleep, and they're just, what's going on? And so for the proper candidate, a trial of hormones might be appropriate. And basically sometimes it's just a trial to see how they feel, if they're feeling better.
I think that it's important to also dissect the specific complaints that they're having. Is their main complaint insomnia, that they can't sleep, or nighttime awakening? Because it could be that they've drink a cup of coffee every night after dinner. That's what they've done their entire life. But now their body can't tolerate that, you know, and it could be lifestyle things that they need to change, or it could be something that hormones may be playing a part in as well. And this goes with a lot of the symptoms that are attributed to the perimenopause, whether that be incontinence, whether that be other things with sleep. Sleep apnea is very much underdiagnosed. So there's lots of things that we can explore. It just depends on the specific complaints that are at issue.
Dr. Canyon, you know, we've talked a little bit about relationships and how this can affect a relationship, but I'm also interested in intimacy. This is PBS, so it's a family show, but I am curious to know the effects on sex drive and the effects on intimacy and how you see that play out with your patients.
Low libido is a very common complaint that we see, and part and parcel of that can be that there's vaginal dryness and pain during sex as well. So you have a lack of interest, and then you have an uncomfortable experience as well. And so those can affect intimacy, relationships, and that can become very complex or complicated. There are a lot of treatments, and maybe some of the others would like to discuss some of the treatments that we have for that. But also, I would encourage people to seek help with a therapist as well, because we know a lot of the problems behind intimacy have not only a physical basis, but a psychological basis as well. So I don't know if one of the others here would like to comment on some of the treatments we have for the physical complaints.
So the question is specifically more about sexual
About intimacy
side.
and what it does to your sex drive and how menopause or perimenopause impacts that part of a woman's life.
Yeah, so a lot of times when we're talking about vaginal dryness and pain with sexual intercourse, it is a later symptom. Now, there are definitely some women in perimenopause who go ahead and, you know, they get their dryness early. But because in perimenopause your hormone levels are fluctuating, you often get even higher levels than normal of estrogens at times. So the vaginal mucosa, the vaginal tissue still has adequate blood flow, usually through perimenopause. And it can become a symptom later in life. So first thing as she mentioned, the first thing when they say, I don't have libido, there are so many factors to address. I mean, of course, the first thing is it because you have pain, you know, but is it because you're not sleeping? Is it because you have 3 kids that are, you know, crawling in bed with you at night when when it's time, or when your husband is interested? Or do you have mom who you're taking care of who's, you know, downstairs? You know, are you having any time alone with your partner? There's so many factors that go into intimacy. I'm kind of with her. I really like referring to a sex therapist. We're very lucky to have a sex therapist in Hawaii. Dr. Brito has a group that's excellent, and it's about creating that safe space for intimacy, which can be very difficult in that because of all the other things going on in perimenopause. But again, like I said, that you do have to address: are you having the dryness yet? Are you having the pain at this time? Because
So interesting. So much is riding on all these women, right? When you're talking about all these factors, maybe she's parenting, maybe she's taking care of an older relative, maybe she's working a lot. I mean, it's just so many things.
Right.
And I think it's also very unfair because women are able to look at their partner who's got their little blue pills and who's got their low T, you know, therapy, and it's turned them back to like they were in their 20s. So what can we give our ladies to make them like they were in their 20s? And unfortunately, we don't have a magic pill or a magic prescription that does what that little blue pill does for men.
Okay, well, we need you to do some more research. I want to stick with you for this one from Joan. She says, I was told that the risk of uterine cancer was higher after 65 if you continue to take hormones, so I stopped. I'm 72. I still get hot flashes.
Well, I think the concern is what kind of hormone therapy are you on? If you have a uterus, we will always prescribe an opposing progestin to go with that estrogen, and that progestin is going to protect the uterus, so it can be safe to continue. But with all medications, there's a risk-benefit profile, and nothing should just be on auto drive forever. A responsible physician will be checking in every year to say, well, how are you doing on this medication? Is this something that is still benefiting you? Is this something that you still need? Or maybe you can do with a lower dose, or maybe we should see what a taper and doing without. If you don't need it anymore, why are you taking it?
Dr. Canyon, this one from Miley in Aiea. She emailed us and said how important it is strength training and protein intake, especially in regards to bone density and brain fog.
Very important because I think from the time, well, it starts in your late 30s, but we lose about 5 to 10% of our muscle mass per decade. And so one of the things that we know when we have perimenopausal women who are gaining weight, the thing that I counsel them on is that focus on building your muscle, because your muscle is your warehouse of calorie burning. You're losing it, you're gaining weight. In order to gain muscle, you do have to have adequate protein. Now, that doesn't necessarily have to all come from animal sources or protein powders. There are ways to balance that out. If you're building muscle, we generally recommend 1 gram per kilogram of body weight. But strength training, really, when you hit your 40s, you really should be turning your focus over to strength training. The minimum that we recommend per week is 2 days a week, but arguably 3 to 4 days a week would benefit most. And that when you build muscle, you build bone. So you're already working on maintaining your muscle mass, preventing your weight gain, and you're building bone at the same time.
So, lots of good benefits there. Dr. Goulet, there's a question here from Lawrence in Kaimuki. What about night sweats? I'm a man in my 60s. I often wake up soaking wet even when the AC is on. Is that a symptom of so-called male menopause?
It may be, but we also have to remember we live here in the tropics. The modern gel foam hybrid mattresses that are being manufactured, they're not like the old spring mattresses. Even though they all insist they are cooling, they trap air, they trap heat. And so there's some comfort things that can be done to help sleep easier, certainly turning up that thermostat, but not all homes in Hawaii have a central AC unit or the ability to turn down the temperature. It may very well be a symptom, but it's a hard thing to treat.
There's a caller from Honolulu, Dr. Lawrence, who says, can you address medical menopause? I know we talked about this a bit earlier, but after going through cancer treatment, my doctor informed me that I was done with menopause and I experienced no symptoms. I'm interested in the medical menopause that this caller went through, but also there are some women who don't necessarily go through a lot of what we discussed today. How common is that?
The symptoms of menopause, you mean? Yeah, there are some women that don't experience it at all. You know, like their menstrual period will just stop and they feel just fine and they don't notice it and they don't complain about anything. So I don't know. What would you say?
And it's ethnically
I agree.
based as well. We've got research that shows Asian women tend to be less symptomatic than other groups. Hispanics and African American women tend to be more symptomatic.
So interesting. Okay, wow. There's another follow-up to the question about sexual health that we asked, and Jen says, please address what options are available for women post-menopause to address decreased libido, discomfort, dryness. Why aren't doctors more forthcoming about this? These can be hard conversations to have, but what are some of the options, Dr. Canyon, that are out there?
So if we're just sort of focusing on vaginal dryness, I think, you know, vaginal estrogen cream is generally considered very safe, and it helps to maintain the tissue lubrication. You know, if you're starting from very dry place, it's going to take a little while for that to settle in. So that's one option. Pelvic floor therapy as well. I would encourage women to be doing their Kegels or seeing a pelvic floor therapist. And then there are some treatments that we can use for libido. Unfortunately, Testosterone has been shown more anecdotally to be quite helpful in women, but there's no FDA formula approved right now. And this is, again, probably something a little bit more for Dr. Goulet in terms of some of the other options.
But I also want to mention moisturizers and lubricants. Those can, just like we would put lotion on our hands, they make moisturizers for our reproductive areas as well, and those can alleviate symptoms quite a bit. And there's an easy first step thing to do that don't involve hormones, which can be controversial in some individuals.
Dr. Frattarelli, there's a question here from Cheryl who says, are there any free informational workshops or expo or resources on menopause information, as this subject is somehow not spoken openly about? Of course, we are speaking openly about it tonight, and we're so happy that all of you are here for that. But for those who want to continue this conversation, what resources are out there?
I think that most are online resources. So Menopausal Society has some online resources. They have an online list of their members who are seeing patients and certified practitioners. So Menopausal Society, which is menopause.org, is their website. I'm trying to think what other specific resources are out there. I mean, we don't have anything set up here in Hawaii specifically. It's a great idea because there should be more discussions. I think it's just kind of more hit and miss as far as finding something, just like tonight, right? It's something that we have once, and it's not a continuous thing. So there's not any workshops, or there are also support groups online. So most of the resources you're going to find are going to be.
Yeah, and Dr. Canyon, you had mentioned earlier just community, right? Finding other women and the isolation that some women might feel as they see changes in their body, but really talking to your peers can be helpful too, I would imagine. Yeah,
there's some great books coming out, and I think, a lot of women do engage in things like book clubs. I think I would encourage women to do that. And there is, the Menopause Society does have short YouTube videos that educate the public on menopause as well, that can be really informational. But connection, talking to your friends, being just forthright and open about what you're experiencing, and asking your friend, gosh, do you think it's menopause? Is this what's going on? How are you feeling? I think we just have to kind of shed the shame around it and start to ask more questions.
Yeah. Dr. Goulet, what would be your advice for folks who feel like they want to continue this conversation, and how to do that?
Absolutely. Reach out to your healthcare provider, whether that be your internist, your gynecologist, your lifestyle medicine specialist. There's help out there. I get a lot of phone calls from other healthcare professionals wanting to know where can they go and read up on the current guidelines and recommendations. And we don't just invent things. We follow the evidence-based medicine that the American College of Obstetricians and Gynecologists are publishing, the Menopause Society, the American Society for Reproductive Medicine, the Endocrine Society. This is a very hot topic that medicine wants to take care of, and so the resources are there.
They're there, and we definitely want people to reach out to the provider. I've had so many people that say, I love my gynecologist, she delivered all my babies, but she doesn't want to talk about this topic.
Right.
And why do you think that is? Given all that we know in the conversation that we're having tonight, and what feels like a change, a cultural shift around this topic, especially in the last 5 to 10 years, why do you think that there would still be doctors who feel that way?
Well, I think there's multiple reasons. One is that a lot of those physicians were trained during that time when it just wasn't talked about. So they didn't actually get that adequate training and have not really gotten comfortable with that discussion. And then I think it's time intensive. So you can't stick a menopausal patient into a 15-minute time slot. And if that's what you're trying to see your patients in 15 minutes, you can't do an annual, you can do a pap smear 15 minutes, easy, but you cannot do a menopause consult in 15 minutes. So I think those are the kind of the two biggest reasons. The comfort with not having it being educated and then the time.
And Dr. Lawrence, for women who want to broach this topic with their doctor, maybe, and trying to do it in that 15-minute window, how do you advise the patient to approach their doctor about this topic?
Oh, don't be afraid to bring it up. And if you need to reschedule another visit, feel free to do that. When I speak to my patients, I try to be a little proactive about it, and so I usually bring it up in their 40s, in the perimenopausal years, so that as they approach the menopause transition, they have they have a better idea of what to expect, and if they're a good candidate for hormones, they'll know it at that time. If there's a little bit of lifestyle changes they need to do in the meantime, they have some time to do that and focus on those things, so that they'll maybe be a better candidate, when they go through the transition. Yeah.
Yeah. Dr. Goulet, what's your best advice for folks who are wanting to have this conversation, specifically with their doctors, and how best to do that, especially if they might encounter someone who might not have the time or be a little reluctant to have that conversation?
You have to advocate for yourself, and not every doctor can do everything. So that may not be the best doctor to have the conversation with, but you can always ask, well, who should I go talk to about this? Who would you recommend? Who would you refer me to who does have the expertise and the ability to make recommendations for me?
Yeah, and Dr. Canyon will give you the last word, just, your best advice to patients or to women who are watching tonight who might feel a little lost.
I think we've touched on it many times. Start the conversation, but also I think my best advice to women out there who are going through this or think they might be going through this, prioritize yourself. Prioritize yourself.
And that's a great place to leave us. Thank you so much. We want to thank our guests tonight and thank you, our audience, for all these questions tonight. We loved them all. Dr. Melissa Lawrence and Dr. Emily Goulet, along with Dr. Sarah Canyon and Dr. LeighAnn Frattarelli. Next week on Insights, Hawaiian language, or Olelo Hawaii, is one of 2 official languages of the state by law, along with English. Thousands of Native Hawaiians and others are becoming fluent in this language. So should the state be doing more to expand access to Olelo Hawaii? Please do join us then. I'm Yanji Denise for Insights on PBS Hawaiʻi. Until next time, aloha.
Local broadcasts of Insights on PBS Hawaiʻi are made possible by the support of viewers like you. Mahalo, and by Carl Smith Ball, providing legal services throughout Hawaii